field hospitals are being considered around the UK. Work is currently underway to transform London's ExCeL Centre into the NHS Nightingale Hospital to relieve pressure on hospitals treating coronavirus patients. 500 of the 4,000 beds being set up will be ready from next week, the government has said. Well, let's speak now to Dr. Kunal Patel, a dentist whose team has been drafted in to work at the new hospital. Thank you very much for joining us this morning. So tell us what you know at this stage about the work that all of your team from your dental practice will be doing.
Hello, good morning. So as I don't know, most of you may be aware, we were told to put down our drills early this week, all dental practices across the nation, due to, I believe so, the lack of correct PPE for us to treat our community, our patients and our team, keep them safe. So this whole Institute of the Nightingale Hospital, on Wednesday, we got a message from our chief dental officer. I think it was every single dental practitioner in the country, that we should be ready to be deployed when asked upon at the Nightingale Hospital. I mean, as far as I'm concerned, I think all of us dentists across the country were ready to volunteer regardless. But I know it was a very, very sad day for me and my team on Monday when we had to close up our clinic, because what we do to a day-to-day basis is help patients, and we felt as if we were stepping back and not being able to do our part for the wider NHS. So being summoned to be ready to deploy when asked upon to the Nightingale Hospital, you know, me and my team are ready to go to do our bit and toe the line again.
And I understand we're talking about all of your team here, receptionists, admin, through to the dental nurses, the dentists, obviously. Do you know what roles you will be involved in once you get there?
Yes, so on Wednesday, when we received the letter from the chief dental officer, it said in the aspect that due to our clinical experience and our skills that we have as dentists and training at university level, that we may be asked to do a wider range of treatments. It's not been specifically said what exactly, but they have requested for my entire, or all of our entire teams, to be prepared, from receptionists to nurses to us dentists. So I think from what we are hearing is, if we are asked to do something, and which we will be asked to do outside our dental profession, we will be hopefully made competent enough to do so, and I'm sure we will be.
Now, you mentioned, Dr. Patel, that you were asked to down tools, as all dentists were, because of a lack of personal protective equipment. Do you have guarantees that when you get to the ExCeL Centre, transformed into the Nightingale Hospital, that the personal protective equipment will be available there for you?
Well, from speaking to other dental colleagues, we believe for them to create such an institute, a great institute, it will be available. I mean, one of the main reasons why we were closed down locally was due to the lack of it, for us to be called in. I think as NHS workers, all of us, I think our biggest fear was us transmitting the disease ourselves, possibly. So having this correct PPE, I think, is necessary, and I don't believe they would call us in without having it in place.
Just a final thought, Dr. Patel. I mean, after the clap for carers last night, I just think it's wonderful, amazing how you're there and you're saying that you and all of your team are more than happy to get into the front line of this fight. Obviously, you know, you're in a profession that's there to help people, but there are risks, and it's a really great thing that you're doing.
No, thank you. I mean, soon as my team had heard of the opportunity that we may have, I could see within them, because from day-to-day basis we help people. They were ready to toe that line, and you know, looking at my team, I was so proud of them with all the messages I got when I offered the opportunity to my team. I think it was sad on Monday when we felt as if, I mean, we were doing our part by staying home, but obviously we believe we can do more. I think we believe we've got the skills to help where we can, and we're more than happy to do so. I mean, what the NHS has been doing, and to be thought of that we had to sit at home while the rest of our NHS colleagues were able to help. I think we're ready to do it. We're ready to
Okay.
go. Hopefully we can make a difference.
Well, we wish you the very best, you and all your team. Dr. Kunal Patel, who will be working at the new
Thank you.
NHS Nightingale Hospital in London.
Thank you.